Hi everyone, I am Dr. Kaminsky and I am the course lead for MSN572. I'm going to spend the next few minutes walking you through MSN572 in an orientation and then getting into the content for week one. So as you can see here, we're going to talk a little bit about the course expectations, the syllabus, our textbooks, required clinical components in terms of Complio, immersion, shadow health, APEA, and QBanks, as well as your 3P APEA exam, sync sessions, body system videos, and then how to be successful in this course. So as for the course expectations, this is a 4 credit hour course. It does start on Tuesday. The week always ends on a Monday. So regardless of the week and any holiday, it's going to start on a Tuesday and end on a Monday. That means that you need to be aware that most due dates are by Monday evening. So please pay attention to that. In terms of being successful in the course, you need to ensure that you are aiming for 84% or better on every assignment that you submit. 84% is the expectation for all assignments in the course. In order to be successful, you're going to need to plan ahead. And so create whichever way that works best for you to keep yourself organized, make yourself a schedule of due dates and upcoming assignments so that you know exactly when things are due and can best prepare and study accordingly. Additionally, this may be the term where you need to step back on your workload in terms of outside obligations so that you can focus on the course before starting your clinicals in the next term. When it comes to your syllabus, you need to make sure that you know how to access that. And that is going to be in D2L on the left-hand side. And you will see everything that you need to know about the course contained within the syllabus itself. So a few course specific reminders. I want to make sure that everyone is clear on this. And those are, if you are repeating this course, meaning that this is not the first term which you have taken MSN 572, whether that had been the previous term or many terms ago and you had taken a break, you could not submit any previous coursework that you had previously completed. So that means any videos, written work like write-ups or SOAP notes, all of that work does have to be new and original. If you are found to use previous work, you will receive a 0. So I want to make sure that that academic misconduct policy is understood. Additionally, we will start to teach you how to do SOAP notes in this course, but MSN 572 SOAP notes are not clinical SOAP notes, which count for graduation requirements. So that means that you're not submitting anything to Project Concert for this term. In terms of where to locate policies in the course, this should not have changed, but if you go to your syllabus tab, you should be able to see the student code of conduct, the plagiarism guide, and the USU ADA guide. So those are all contained there for you. Plagiarism policy and code of conduct, again, these have not changed, but all written work is submitted through Turnitin. Students who are found to have plagiarized coursework or copied from another student's work, submitted work that was previously prepared in other courses, may be charged with academic misconduct, as I mentioned, and that would be applicable to any sanction from there. So sanctions can result in a failing grade in the assignment, failing course grade, or even expulsion from the program for up to 2 terms. In terms of the textbooks that you will need for this course, you need to make sure that you have your Bates guide. You can have that by physical textbook or by an ebook. The U.S. Preventative Services Task Force app, which you can see a screenshot on the lower left-hand corner of your screen, and then the Bright Futures Pocket Guide, which is a free resource available to you from the American Academy of Pediatrics. In terms of immersion, we have a couple of dates that we need to discuss. So in week 2, on Thursday, you will be attending your first day of immersion. That will be done virtually from 7 a.m. to 4 p.m. Pacific Standard Time. So all of our times are in Pacific Standard Time. You must be present for that entire session. So we will have designated breaks, we'll have time for lunch, but you do need to be on for the entire session on camera, in professional attire, in a quiet setting, which would simulate an office or some sort of quiet setting in your home. Your Zoom name does need to match the name in which you are registered for USU. You cannot be traveling, working, your background cannot be blurred in any way. And if that is found to be the case, you will be removed from the session and you will actually have to contact your academic advisor in terms of withdrawal and re-enrolling in another term, as this is a mandatory course requirement, just as if you were on campus. So there are No exceptions to this. It is absolutely mandatory that you follow the course policies and guidelines in terms of immersion attendance. With on-campus immersion, you were emailed your dates for that. So if you attend immersion during regular terms, there's usually 2 separate weekends that we have to allot for enough faculty to be available for you for the amount of students that we have. If you attend in D term, usually all students attend that same weekend. That will be in Arizona on campus. So you need to plan accordingly for travel again to be in by Thursday night, or if you are traveling and in the area, you have to be on campus at 7 a.m. on Friday morning. And then it does go until Sunday at 5 p.m. So if you are flying or traveling back home, please make sure that you are not booking any travel at least 2 hours from that, because you will not be released from the session early to accommodate travel plans. It is mandatory from 7 a.m. to 5 p.m. Friday through Sunday. This will give you a tremendous experience of hands-on practice and skills, getting to work with other faculty members, getting to work with gynecological assistants in terms of doing pelvic examinations. So it is a unique experience offered by USU, and we really want to give you the best preparation that we can for your clinical environment. If you have any questions, the immersion page on the Nursing Caring Corner page or the course is the best resource for frequently asked questions, what to expect. And then if there are no question, excuse me, if you have questions that are not answered there, please contact immersion at the email address on the screen below. So preparing for clinical experiences, we need to speak about this, as this is the last class you'll take before you go to clinicals. Need to ensure that you are remaining in Complio compliance. And so Complio functions just as a state board of nursing would. Need to make sure that all of your immunizations are up to date, anything that is about to expire, TB screenings, anything like that is accounted for on time. So address those soon to expire documents as soon as possible. You'll get multiple reminders on those. If you are out of Complio compliance, you cannot attend clinical. If you do so and you attend clinical out of compliance, not only are those hours not counted, but it is a code of conduct violation, which could result in course failure. With clinical placement coordinators, you need to be working with your CPCs often. This is with OFE to secure your clinical preceptors and your sites. So all of the documentation is in place as early as possible. Believe it or not, things change in these 8 weeks. So just because you have a clinical preceptor lined up or a clinical site lined up, things do change at those locations, or contracts may not be signed appropriately in a timely manner. So we want to make sure that you can work on any delays during this term. Delays can be external. That means outside of USU, outside of OFE, and your clinical placement coordinator may not be able to work with you to get those things done in a timely manner if it's an external issue. So please start working on that as soon as possible to secure those contracts to avoid any delays next term. With scheduling clinicals, another thing you need to know, as I mentioned, courses always start on Tuesday, is that you should not be scheduling your very first clinical for Tuesday or Wednesday of FNP 592. You should ensure that all of your clinical documents are submitted to your course, but your instructor is going to need to approve those documents before you are allowed to attend clinical. So again, please make sure that you're being mindful while you're planning your clinical schedule for the next term. Next Tuesday and Wednesday, the very first days of the term, you should not be planning to be in clinical with your preceptor. Now, talking a little bit more about course elements, we're going to discuss Shadow Health. So this is our virtual simulation software. This is utilized to give you a lot unique experiences that you may not otherwise get to have in this course, as we have limited time with you in immersion. So in weeks 1 and 2, we know it's difficult to learn new software, and we are giving you the opportunity to submit multiple times in terms of your Shadow Health work. What you're going to do is submit your lab pass of your best course assignment, or excuse me, your best coursework in Shadow Health to us in D2L. So you do that by submitting a lab pass, and you'll see on the right-hand side of your screen exactly what it looks like in Shadow Health and how to locate this lab pass icon. So you will submit that lab pass for each module you complete into the Dropbox, and that's always going to be due by Monday evening. We use what's called the DCE score. That is a score that you're going to get from Shadow Health called your Digital Clinical Excellence Score. That's going to be the score that we average with all the modules for the week and put into the gradebook. Some weeks don't have a digital clinical excellence score, and that's usually the weeks that have a concept lab or an orientation to that specific module. In those cases, there is a student performance index or SPI score that's used. So we merge those scores together, and that will give you your score in Shadow Health for the week. The scores, again, should be 84% or higher, or you will receive 0 credit on the assignment. So keep in mind, weeks 1 and 2, you have multiple opportunities to practice, really learn the system, learn how to navigate it, and then you'll submit that lab pass to us. Your Shadow Health assignments are worth 14% of your grade in the course, so it is very important that you dedicate the time and the effort into those modules. So they are really going to help you learn your assessment skills and kind of put those skills into practical application. Now we talk about APEA Q banks, and so you've had Q banks in pharmacology and pathophysiology. Your access to Q banks this course will begin about midweek, week 2. And so if there is any delay in access to those Q banks, we will give an extension. But usually by midweek 2, we will have this Q bank APEA access for health assessment for you. Now, that being said, there's nothing due in week 1. So please don't freak out that you have anything to do in week 1 when it comes to these Q banks. This is going to test knowledge over all body systems, and it's going to be related, again, to physical assessment to this course. You do not have access to your previous pathophysiology and pharmacology Q banks anymore. The access is granted per course. You need to make sure that if there are more than 40 questions, you're doing at least a minimum of 40, and you're going to send us that screenshot into the D2L Dropbox. If there are less than 40 questions, you need to do all of the questions for that Q bank. Some have 17, some have 27. It's just going to depend on the module. So in those cases, if it is less than 40 questions, you need to do all of them and submit that again to the Dropbox. You can do that in either tutor or exam mode. And these are worth 10% of your overall course grade. Now, something unique to this course is your 3P exam. So your 3Ps are pathophysiology, pharmacology, and physical assessment. This is going to be a final exam that you are taking in week 6 through week 7. So it's going to start Sunday of week 6 and end Thursday of week 7. This is 75 questions, so 25 questions from each of the Ps to give you your 100%, as you can see on the bottom. This is worth 15% of your overall course grade, or 150 points. You need to make sure that you are continuing to study that knowledge basis of pathophysiology and pharmacology. I also recommend nurse practitioner board certification questions, that you start working and integrating those into your studying as you're going through each module. That is the best tips that I can give you in terms of how to be successful on this. Q banks alone are going to give you a good base, but they're not going to be 100%, and those questions are not replicated. So on this, if you score less than a 70% overall out of these 150 points, if you score less than a 70%, so meaning 69% or below, you are required to complete remediation. Dr. O is our student success coordinator, and she will be sending the instructions on how to complete remediation. Remediation is required. It is a mandatory part of the APEA exam if you have not met that 70%, to show that you are competent and able to attend clinicals with that additional study and knowledge base. It does not, however, change your overall course grade, regardless if you complete remediation. So if you have a 70% or above, you do not have to complete any APEA remediation. This does give you a lot of different topics and diseases, illnesses that you may see on the exam. This comes directly from APEA's website itself. This is a hyperlink above, and I will have this PowerPoint posted for you. Now, in terms of sync sessions, you are in week 1 town hall sync session. This is your orientation to the course. You will find that the remainder of the sessions will be posted for you in the sync session document. So please make sure that you are watching those early in the week, as I give as many helpful tips as I can on how to be successful, reviewing a little bit of pathophysiology and some nurse practitioner pearls as you're getting into the curriculum. These are always going to be due again by Monday night in terms of your summary, but these sync sessions will be available for you. Now for body system exam videos, you're going to do multiple of these. So I want to spend a good bit of time talking about these. There are many requirements here, and you can reference this at any time. But prior to recording any body system exam video, there are several aspects you need to complete. Number one being introduce yourself. You should not be showing your ID badge on camera. If you do, YouTube will flag that if it is a close-up of your ID badge, and it will actually flag it as bullying and remove your video and not allow you to post at any time. So you'll have to record the video all over again with a brand new video. In terms of other things that you need to submit, you need to also state, after you say your name, you need to state the date that you were recording the video. So that's imperative that we know that you were recording it on this date in this term. You must then also complete a room scan. So you do that by showing us all 4 walls of the room that you are filming in. You're also going to show us the ceiling and the floor. And that's going to allow us to see that there are no notes or anyone else in the room available to help you or assist you in any way. In week 1 only, you can use notes, and we'll talk more about that in just a few moments. Finally, you need to obtain verbal consent from your patient to record the video for grading purposes and upload it to YouTube as unlisted. And that is for your instructor to view and grade. So unlisted is different than private. Unlisted means that only the person that you provide the link to can access that video. It is not otherwise searchable. If you submit it as private, we cannot view it, and you will be assigned a 0 for the grade. So please make sure you choose the correct option. There is public, unlisted, and private, and you need to choose unlisted when you are uploading that video. Another thing that I do want to mention with YouTube, if you've never submitted a video before, is that it can take a very long time depending on your internet speed and the length of your video. So please plan accordingly. I would give yourself at least 6 hours from the due date. So make sure that you are not submitting anything late due to YouTube delays, that you record your video, you are watching your video before you're submitting it, and then you're uploading it to YouTube. Again, what you're going to submit to the course itself, though, is just the YouTube link so that we can view and access it for grading purposes. If any of those steps are forgotten, you cannot edit your video in any way. There is no editing permitted throughout the entire term. So all 4 of those must be present on your video for it to be graded. So I recommend, as you're practicing your very first video, that you're going through these steps. When you are allowed notes in week 1, you can have that written down, that you are going through your mental checklist of all 4 aspects you need to have. Now, I said after the recording, so you're going to watch your video all the way through. What you should be doing is grading yourself based on the rubric. So the rubric is fully transparent and available for you to study from, to make notes on. And then when you record your video, you should not have your rubric in front of you. However, before you submit your video for grading purposes, I highly recommend going through that rubric and doing a checklist so that you ensure you have submitted your best video possible. The orientation also must be straightforward. So just as I've recorded this video for you, it's not tilted 90 degrees. It's also not upside down. It's not at an angle. So you see the video exactly as it is filmed. The video must be uploaded to YouTube. We do not accept any MP4 or .wmv files. It does have to be YouTube, or it cannot be graded. Now, additional aspects of exam videos is that you have to perform this on a live partner. So for week 1 and your head to toe only, those videos have to have a patient 18 years or older. That can be your spouse, a family member, a coworker, a friend, a colleague, a neighbor, whomever you want to choose, because they will give their verbal consent on video. Week 1 and your head to toe is going to be obtaining a lot of information and health history. So it would be inappropriate to do that on a pediatric patient. Now, for week 3, which is your abdominal video, week 4, HEENT, week 5, which is cardiovascular and respiratory, week 6 is neuro, and week 7, musculoskeletal. On those videos and during those weeks, if you choose to do your video on someone younger than 18, they have to be at least 6 years of age. That might be your cousin, your family member, your friend, your daughter, your son, again, a neighbor's child, whoever it is. However, Since it is a pediatric patient, you need to make sure that the parent has provided verbal consent and is present during that video. So that is the mandatory requirement if you are using a pediatric patient. Now, if it is your child, you're just going to verbalize on camera that you're giving consent and for your child to be recorded. And again, for this to be graded by your instructor. With filming the exam, it should be filmed in an environment that would simulate an exam room. So it should be indoors, quiet, with good lighting, and no others can be seen in the room or heard at any time. So nobody should be walking across the stairs, entering the door, heard in the background. Those are all really important aspects to make sure you're filming the exam appropriately. If those happen to be present and you're watching your video before you submit it and you see it, unfortunately, you will have to redo your video and re-record it. If you submit your video and we see that that's happened, it will not be accepted for grading purposes, and in that case, it will receive a 0. As I mentioned in week 1, we do allow you to use notes as you're getting acclimated to recording. It's also with the health history, a lot of information as a nurse practitioner to try and transition from your nursing knowledge to the provider model. So we do allow notes for the very first week only. What that means is that you can have a piece of paper, you can go through a checklist with your patient, but you should also be focused on good eye communication and good rapport with your patient. As I mentioned, there is no editing in any way that is outside of USU policy. Now, in terms of visibility, you need to make sure that you are within the camera view at all times. If you step out of the camera view at any point where you completely exit that view and we cannot see you, we cannot grade your video after that. So that's just as if you would have left the exam room and the patient had gone home for the day. You cannot go back into the exam room and continue the exam. So again, I always mention, please make sure you're watching your video before you submit in case you happen to step out of view and you didn't otherwise know it. If you've watched that video, you've reviewed that you are within the camera frame at all times before you submitted it. There are some time limits on videos. So in terms of your head to toe video, you do have 60 minutes to do that. And then other videos are going to have set time limits, 45 minutes or less. So the time constraints of these recording are for your burden, your patient burden and time in terms of being there for your practice, and then your instructor's time burden for grading as well, as there's multiple videos of grading each week. As FNP requirement, you do need to properly perform a complete physical examination in order to be a successful nurse practitioner independently seeing a patient. So a student cannot simply skip a week or fail a week, even if the passing score is 100% in all other areas. You are encouraged to submit, like I said, at least an 84% or better every single week. Finally, the video does need to be completed in English, and we must be able to clearly hear you and your patient in order to grade the video. So now when we come to documentation, we talk a little bit about variation here. In some weeks, weeks 3, 5, and 7, you will have a write-up due in those weeks. And what a write-up is just your objective findings, just your documentation of your physical examination of the patient. You will need to make sure you're using medical terminology and you're using your rubric in terms of what are the areas that you assessed: inspection, auscultation, palpation, percussion, depending on the skill, and then any special assessments that are also done. SOAP notes, however, and we'll talk a lot about these in immersion and on your virtual immersion in week 2, are going to be the full aspect of documentation. So subjective information from the patient, objective, which is your physical exam, your own findings, the assessment, which includes differential diagnoses and rationale, and then your plan section. So now we are on to week 1, and we're talking about the course activities. You are here in town hall, which is your sync session, your sync session, and you are going to complete your review on by Monday night. And that summary is going to be 200 to 250 words about what you learned in this session. Please make sure, again, this is your original work. We submit everything through Turnitin, as I said. So anything like Course Hero or another student summary is going to highlight, and you're not only going to receive a 0, but you're also going to be in violation of the academic misconduct policy. We do have a discussion in week 1, which is an introduction to your peers as well as your instructors. So please make sure that you are completing that by day 2 of the course. We also have 3 Shadow Health modules this week. So your digital clinical patient orientation, your conversation concept lab, and your health history module. You can take those up to 5 times each, and you need to submit your lab pass to the Dropbox. Your QBank access, as I mentioned, will take place in week 2, and then we are going to focus heavily on your health history video and documentation for week 1. What you'll see here are your reading assignments for week 1. So 5 chapters that you'll have from your Bates textbook, but these are very foundational chapters. So I encourage you to really make sure that when you are reading it, that you're contemplating all of the information that you see, especially the health history information, the physical exam, and evaluating clinical evidence. It's going to set you up for success in the remainder of the course and your clinical terms. So some things we need to consider in terms of health history and interview are that there are very different aspects of interview depending on our patients. So we need to consider patient-centered interviewing. That means we're taking the objective information, or excuse me, the subjective information provided by the patient. So subjective always means that the subject is giving you that information. It's never your own assessment. And you're using open-ended dialogue to establish rapport, to gain that information in a very non-biased communication method. We also have to consider social determinants of health, which are aspects of health and wellness and factors that affect that. So it can be everything from employment, access to healthcare, different aspects like access to food. And so those will vary depending on patient and population. We also consider cultural competence and the need to integrate cultural care and cultural aspects of care, whether that be spirituality or a patient's own belief system. So do not have implicit bias. You always want to make sure that you are integrating those and asking your patient if they have any cultural care considerations we need to be aware of and integrate. And then finally here, health history. So we are going to consider these things, talk about them heavily in week 1, as well as in immersion with introduction to SOAP notes. Some key components of a comprehensive adult history, as you can see here, this is from box 3.3 in your textbook, and this leads you through everything that we are going to do for week 1 outside of your risk diagnoses, and that will be the last portion. In terms of how to access your rubric, as I said, this is very transparent. You can access your rubric for every assignment in this course, especially the videos, by clicking on the assignment itself and then locating in the right lower corner the assessment rubric, and that will bring it up for you, which you are available to view at any time or print. For the week 1 health history rubric, this is just a screenshot of several different aspects of it. And so you'll see that you are graded on several different measures here with 10 points for this very first one, or the most points possible if you have exceeded expectations, and then what goes into that. Meeting expectations or competent with a few less points, below expectations, and then far below standard. So we want to make sure you are doing your best to exceed expectations, really meeting all components of the assessment at every single rubric item. And there will be a description below based on the criteria of how to complete that. You'll see this goes on the same for HPI, past medical history, family history, and social history, and then review of systems and patient risk assessment. So I encourage you, again, like I said, to print that rubric, as this is just a screenshot for each slide I've shown of the rubric itself for week 1. So in terms of documentation, we also provide you with examples in week 1 of an example health history worksheet with directions to get you acclimated to the information and how to complete it, as well as a blank worksheet just below that. So those links are available for you in the course. This is just a screenshot of what it looks like. And then your week 1 assignment is below that. You need to ensure that you are asking the questions appropriately. So you cannot document any information in which the patient does not provide to you on camera. That means for review of systems and asking about many different symptoms for each body system, if you do not ask it, you can't document it, even if you know it to be true for the patient. When it comes to using the information, you are going to develop 3 potential risk diagnoses for your patient. So based on everything you learn about your patient, you're going to consider 3 specific risks for them. And these are going to be medical diagnoses. So no longer those nursing diagnoses of ineffective, You want to think about what is a medical diagnosis. That might be obesity, it may be depression, maybe alcoholism, it could be ineffective sleep or difficulty sleeping or insomnia. It could be a cancer or hereditary risk. It might be something like hypertension if many people in their family have hypertension. So those are all things to think about there. What you will need to do is support each risk with a rationale, meaning that you are providing information about how you came up with that information and telling us where you located a source to support that. So, one of the hardest aspects to learn in terms of physical assessment is where to document the correct data. So, subjective information means, again, like I stated, information told to you by the subject or the patient themselves. So, examples of that are going to include symptoms, feelings, perceptions, and concerns. Whereas objective information is going to be your physical examination findings. So anything that you are physically quantifiably able to reproduce. That may be lab data, maybe diagnostic studies, and again, your own examination information. So it's very different if a patient is experiencing chest pain, that is their subjective report, whereas tenderness on palpation of the anterior chest is an objective, quantifiable, reproducible data, and that is your objective data. So knowing the difference helps you group together the different types of patient information. These distinctions are equally important for organizing written and oral presentations about patients into a logical and understandable format. The clinical record from the chief complaint all the way through the review of systems, so everything we're doing for week one, is your subjective information, whereas objective information is your physical exam, lab data, and any test data, as I previously mentioned. So now, as we are obtaining subjective information, this is the elements of subjective information I continue to mention, but in more detail. So your ID section is going to contain your demographics, and these are all elements of information we need to know about every single patient. So rather than list their name, we want you to put their initials, their age, their sex, meaning their gender, their date of birth, race, ethnicity, if they are accompanied by anyone with them, and is this patient a reliable historian? So for every single SOAP note, for write-ups, you need to be including this ID section. With chief complaint, or CC, that is our abbreviation or acronym that we often use for chief complaint. This is the patient's reason for the visit in their own words. So for week one, this is going to be a well exam. It should not be any complaint whatsoever. It should be specifically based for a well exam. So please coach your patient before filming your video that when you ask them the reason for their visit or their chief complaint, it should be a well exam. For HPI, or the history of presenting illness for a well exam, this is the next aspect of your subjective documentation. This is going to summarize the past health history of the patient, as well as documenting the month and the year of their last annual exam. So for this week one, while you are doing your documentation, you can have the patient tell you this exam was done recently, but you need to, again, document exactly what your patient tells you. You should also be asking them any pertinent health maintenance questions and including that as part of your HPI. So if this was a problem focused visit as opposed to a well visit, we do use the old carts method. And again, this is an example of how you would attribute different symptoms or a problem focused visit for a patient while you are asking their questions. I don't want to confuse you on how to do this in the HPI. So again, we'll focus on well visit only for week one, and we'll talk more about focused visits in week two for introduction to SOAP notes. There is an example listed in your textbook, which gives you the chief complaint. I'm here for a checkup, and some information in terms of a practice or a theoretical patient who might be presenting with some prior medical history. They're coming in for a checkup, what they had done recently. So you have an example that you can review from your textbook. In terms of documenting the health history, we now move on to our next aspect. And I recommend documenting these in the form of bullet points to keep your notes organized. What you'll see in the example worksheet, whether you use the blank one or the one with directions, is that the information is going to be listed on different lines. That's to allow the reader to quickly find the information with the header and then the information listed underneath it. So, with medical problems, we need to know about the problem itself, the patient's age of diagnosis, and the status. So, is it well controlled? Were they diagnosed at a very young age, which might be a concerning disease process or illness, as opposed to having it later on where it may be more physiologic? Psychiatric history, we ask about this. Has there ever been a previous psychiatric diagnosis in the year? And did it result in any hospitalization? There also is an example for you in your Bates textbook. Has the patient ever been hospitalized? And if so, you need to know when they were hospitalized based on the year and for what reason. With surgeries, we ask about if they've had any surgery, the reason for the surgery and what type, and again, what year that was performed. Another aspect about surgeries from a nurse practitioner perspective is have they had any complications? And maybe that was post-operatively or with anesthesia. So we do ask about both of those and document as such for each surgical procedure. Additional aspects of the health history here are medications. So the name of the medication, the dose, the route, the frequency, and the indication. All of these aspects need to be documented from a nurse practitioner who is reviewing a medication record. So no longer just the name of the medicine and how often. It needs to be the name, the dose, the route, frequency, and the indication. We know that many vitamins and supplements, as well as over the counter medications, are taken by patients. So just because it is not prescribed does not mean that it is not important. Please list those accordingly. If your patient is not taking any medications, any supplements, vitamins, anything over the counter at all, again, you would put patient denies taking any over the counter medications, vitamin supplements, or any prescribed medications. With allergies, we're now asking a bit more than you're probably used to from the nursing perspective. So we want to know not only about medication allergies, but we also need to know about food and environment. These three aspects of documentation for allergies belong on every single SOAP note that you do from this point on, as well as in your clinical courses. So you're going to ask the patient, do you have any allergies to medications? They may say no. How about any food allergies? Again, they may say no. Do you experience any environmental allergies? If they said no to all three of those, you would use this bottom example and document patient denies medication, food, or known environmental allergies. Now, sexual history is something that is often uncomfortable to start to get in this habit of asking patients as part of a well exam, but it is very important. And so the Bates textbook breaks this up into the 5 Ps, and that stands for partners, practices, protection. With protection comes any past history of STIs, pregnancy plans, and plus. And so you'll be able to see what all of those have in compromise for them. And so I recommend that you review this slide again on your own time and go refer back to your textbook so that you can understand the best way to really accumulate the information in terms of sexual history in a non-biased manner. If your patient is of female sex, you need to ask about OBGYN history, and this is going to include their last menstrual cycle, the number of days between cycles, characteristics like is it heavy or light, the number of days that the cycle lasts. You also want to ask about things for health maintenance like their last PAP or their last mammo, if that's age appropriate. If they have previously been pregnant, you want to know about the number of pregnancies, as well as the number of living children, any prior miscarriages, and pregnancy complications. And we're also documenting any birthing or maternal history required for children. With health maintenance also comes immunization. So you're going to ask your patient if they are up to date on their childhood vaccination. So that's going to include usually starting at birth or 2 months all the way up until 18 years of age and boosters associated. We also ask every patient if they have received their annual influenza vaccination and when was the last year they did so. COVID series, did they receive any COVID vaccinations? Again, which one, if they happen to know it, how many, and their last dose, and then any boosters as that may be relevant to the patient. Health maintenance might also include a couple other things, and Bates has that in page 88, like tuberculin tests, breast exams, like I said, mammograms, PAPs, stool testing for occult blood or a colonoscopy, cholesterol screenings, their last dental exam, their last eye exam. So those are just a few examples for you. With family health history, we're going to get into first and second generation. So, first generation meaning immediate relatives, parents, and siblings. And second generation is going to be grandparents on both mom and dad's side. It is described as maternal grandparents and paternal grandparents. Documentation, so the age and the health status, we need to know, are they living or are they deceased? And if they're deceased, we need to know the cause of death if known. If it is not known, you do need to list that it is not known. What you will not receive points for is omitting this section or not including the appropriate information. If a history is unknown, as I stated, you must mention that. What do we need to ask the patient about when it comes to each person in their health history? So we're concerned about things like inherited conditions, cancers, and non-modifiable risk factors. So you see several that I have there listed, and that's just going to help gauge an idea in terms of what to ask for. Now, box 317, this is in your Bates textbook. This is going to talk about personal and social history. So we're asking our patient, where were they born? Their occupation. Their occupation is going to tell us a little bit about financial security, job history, and any work-related hazards. If they have any military service, which we should be asking every patient. If they were a prior military service and a veteran, we thank them for their service. We also ask any risk related to where they were stationed or active. With education, we're asking about their highest degree obtained and if they have any special needs for literacy or preferences for communication. Support and social support, we're asking if they are single, if they are with a partner in any way, if they are widowed or they live alone. Again, that's going to affect their social support and things we need to know for our patient. With safety, we're looking at relationships, safety in the home. If a patient is driving a vehicle, it would be relevant to ask them if they are wearing their seatbelt or if they are riding in a vehicle. However, if they are using public transportation, such as a bus or they are on a subway, that's not likely something we need to worry about at that point. When it comes to firearms, again, we should be asking every patient about this. If texting and driving is relevant to the patient, again, if they are driving a vehicle, that's something we should be asking about. SPF exposure, so all of these, intimate partner violence, all things that we should be asking our patients about. With spirituality, not every patient has a religious culture or background, but we do want to ask about any alternative health practices and how do we integrate that into their health to make sure we're meeting their healthcare needs. Well-being and leisure activities, so this can include sleep, nutrition, exercise, coping with stress, emotional needs, and activities. I do recommend that you start to be as specific as possible in terms of your documentation. So when you're asking your patient about sleep, you shouldn't just say, how do you feel you sleep? And they say good and move on. You should be asking them, do they have a good sleep pattern? Do they get to sleep about the same time every night? Do they sleep through the night? About how many hours of sleep are they getting? With nutritional review, we want to know, do they have a balanced diet and what is balanced to them? Okay, so a subjective term like balance may mean very different things to different individuals. So we're trying to ask about, do they have any dietary modifications? Are they eating 3 meals a day, 6 meals a day? Do they intermittent fast? We need to know about this information. With exercise, we're talking about what types of exercise, how many minutes, and how many times a week they are doing that. So maybe they exercise by swimming 30 minutes 3 times a week. Coping with stress, how do they do that? What do they do for their stress? Do they talk to somebody? Do they go home and sleep? Do they journal it? What do they do for their stress? And are their emotional needs being met with that? And then activities enjoyed, good to know. So we can again start to relate to our patient. And if we are establishing a relationship with the patient down the road, this can be helpful. We should be asking every patient about their substance use, and we should be asking at every visit as this can change. So that includes recreational and illicit drugs, as well as any alcohol, tobacco, and vaping. And then finally, activities of daily living. Do they need any assistance with these? And so these are the things we're thinking about: bathing, toileting, walking, eating, preparing their foods, getting to the store. So those are activities of daily living and any assistance needed with those, as well as limitations. Now we're getting into the review of systems, which is the most unique part, usually if you have not been previously introduced to this in an inpatient setting. This is the hardest part for most new nurse practitioner students to understand how to document, so I highlight this very heavily. There's a great example in your textbook, box 319, page 103. But again, you can only document the symptoms that you ask the patient. In terms of this week one, we are doing a comprehensive review of systems. That means you are asking about every single body system and symptoms that relate to that. And you should be asking a minimum of 3 for each. So box 318, as I promised, this gives it to you right here. You're going to ask the patients about dysfunction in the associated system. A lot of times these are closed-ended questions where we're going to ask the patient and start this by saying, have you ever had any or recent changes in? And then you're going to list symptoms and go body system by body system. So once we've collected all of that subjective information, we're now on to our risk assessment, which I mentioned. And this is when you are looking at all of the information obtained from the patient and you are looking at what are potential risks for them. So at this point, this is now off of the video. This is documentation only. And you are going to consider incidence, morbidity, mortality, potential complications. But your rationale for why this is a risk for this specific patient needs to be evidence-based. So we don't often use our textbook as a scholarly source, but this is a good first reference to start looking at, as well as the U.S. Preventative Services Task Force that gives us a great idea about different screenings based on patients. Again, their age, their gender, possible incidences related to their race and ethnicity. So I highly recommend looking there. So an example of how it should be written is listed below for you with the risk, as well as the diagnosis code and ICD-10 code, the rationale, and then you would provide an in-text citation with the author name and the year. And so that's just an example to provide to you on how that should look. Now, clinical reasoning, as I mentioned, this is one of the chapters in your book for this week that you need to be reviewing. And this is going to help you start to learn about differential diagnoses, taking the information of the patient's story and data acquisition and gathering an accurate problem representation. You're going to generate your hypothesis or those problem statements. You're going to search for different rationale as to why that's important to get to a leading diagnosis. So finding good sources for evidence-based, again, this presentation is available for you, but this is a live link to the College of Nursing and Health Sciences for research resources on evidence-based practice. There's also a Loom video here for you on scholarly writing tips, so I highly recommend checking those out as you're going to need them from this course on. You may also know about risk stratification tools or calculators like MD-Calc, and those can help add rigor to your claim or your plan. I wanted to highlight a few APA issues that we see commonly so you don't lose points on this. And those are inappropriately capitalizing or having capitalized text for every letter of the every letter of the words for the title. So it is only the very first letter of the very first word of a title when it's an internet article, in terms of a journal article that you found that you want to reference. So please make sure that you're reviewing APA format on this. Not using a group author when one is available. You also want to make sure you're writing out the whole name and not just the acronym in your reference. Not citing appropriately. So you need to be using in-text citations to make sure that you're appropriately crediting your author or where you found the information. And then other things are title pages, page numbers, headers, and reference pages. So sources which are not primary, and these are layman's resources for patients only, and these include WebMD, Mayo Clinic, Cleveland Clinic, Healthline, medical blogs, other patient-based resources. These are not helping to add any benefit to you as the clinical provider. So this is not MSN level learning. If you ever have a doubt about a resource, you can absolutely reach out to your instructor. Now, secondary sources, again, they're not ideal. These are things that we should be maybe as a starting area when we have some clinical question and we are thinking about a potential diagnosis, but these are not the primary. So they are secondary in that they take a lot of information and they summarize it. They put it into a condensed source. So these can include Epocrates, Up to Date, Stat Pearls, Lippincott Advisor, FP Notebook. Those are not, again, primary. Your course textbook, again, also a big summary of information put into one. So those are your secondary sources. So, all of those are a few tips as I have going into week 1. I try to give you as best of a summary as I can each week. And again, you'll need to submit your sync summary by Monday evening. I wish you all the best. And if you have any questions at all during this week, please reach out to your clinical instructor. Have a great week.